Cough and sputum. Cough is a common presenting respiratory symptom. It occurs when deep inspiration is followed by explosive expiration. Flow rates of air in the trachea approach the speed of sound during a forceful cough. Coughing enables the airways to be cleared of secretions and foreign bodies. The duration of a cough is important. A cough of recent origin, particularly if associated with fever and other symptoms of respiratory tract infection, may be due to acute bronchitis or pneumonia. A chronic cough associated with wheezing may be due to asthma. Sometimes asthma can present with just cough alone. An irritating chronic dry cough can result from esophageal reflux and acid irritation of the lungs. It may be a feature of late interstitial pulmonary fibrosis. A similar cough is not uncommonly associated with the use of the angiotensin-converting enzyme, ACE, inhibitors, drugs used in the treatment of hypertension and cardiac failure. Cough that wakes a patient from sleep may be a symptom of cardiac failure or of the reflux of acid from the esophagus into the lungs that can occur when a person lies down. A chronic cough that is productive of large volumes of purulent sputum may be due to bronchiectasis. A change in the character of a chronic cough may indicate the development of a new and serious underlying problem, e.g. infection or lung cancer. Patients' descriptions of their cough may be helpful. A cough associated with inflammation of the epiglottis may have a barking quality. Cough caused by tracheal compression by a tumor may be loud and brassy. Cough associated with recurrent laryngeal nerve palsy has a hollow sound because the vocal cords are unable to close completely. This has been described as a bovine cough. A cough that is worse at night is suggestive of asthma or heart failure, while coughing that comes on immediately after eating or drinking may be due to a tracheoesophageal fistula or esophageal reflux. It is an important, though perhaps a somewhat unpleasant task, to inquire about the type of sputum produced and then to look at it, if it is available. Be warned that some patients have more interest in their sputum than others and may go into more detail than you really want. A large volume of purulent, yellow or green, sputum suggests the diagnosis of bronchiectasis or lobar pneumonia. Foul-smelling dark-colored sputum may indicate the presence of a lung abscess with anaerobic organisms. Pink frothy secretions from the trachea, which occur in pulmonary edema, should not be confused with sputum. Hemoptysis, coughing up of blood, can be a sinister sign of lung disease and must always be investigated. It is best to rely on the patient's assessment of the taste of the sputum, which, not unexpectedly, is foul in conditions like bronchiectasis or lung abscess. Causes of hemoptysis: respiratory, bronchitis, bronchial carcinoma, bronchiectasis, pneumonia. The above four account for about 80% of cases. Pulmonary infarction, cystic fibrosis, lung abscess, tuberculosis, foreign body, Goodpasture's * syndrome, pulmonary hemorrhage, glomerulonephritis, antibody to basement membrane antigens, rupture of a mucosal blood vessel after vigorous coughing, cardiovascular, mitral stenosis, severe, acute left ventricular failure, bleeding diatheses.